research finding which has come out after a lot of research is already been explained by Lord Thiruvalluvar in two important couplets. He says that this is essential for survival in two words. One is Settarul and other is Alagaya. A person who doesn't have a social cognition or a social relationship, it should be counted among those who are already dead, or a person who is like a ghost. So Vatta Arivan, here it means that there is a common wisdom or an association with other people's thoughts and ideas. He said that person is alive, Veer Valvan. The people who Matrayan, people who do not have this sort of a common association with others, Settarul Vaikapadu. So that person is already dead. And here, Ulagathar und என்பது இல் என்பான். So he has a contradictory idea about others' beliefs, faiths. That person can be considered as a ghost, as a living person who is already dead. So the third concept is that even if we are giving some sort of you are in a particular idea, you are decided about aram in a particular lifestyle, that has to be counter-checked by the others. Aran ennappattathu ilvaalkai, piran pazhippu. Who decides that? The others have to give you a final yes to that, to your behavior. So you find that there is a social agreement in all of the three couplets, which is essential for survival. Now, another interesting study, I tell you, sir, this is done by the same group of authors in experimental science, economic experiments, wherein they have given paid money to the blood donors. In another group of people, they have not paid money to the blood donors. They found whenever the money has been given to the persons who are given, who are about to give blood, they decrease the willingness to donate. This is very surprising. Then that means that the good job they are doing cannot be given by money. So that Uppirvinal varum kedenin attorvan vitrukol takkadu udaitadu. So this Quran says that even if there is something wrong or something which is bad, which is going to happen by Oppuravu. Oppuravu means social cognition or social understanding. You can pay for it. Even if there is a loss, you can go for it. So here the money is secondary. What is primary is the social understanding. So that has already come out so many years ago. So many thousands of years ago, Lord Thiruvalluvar has charted and elucidated and given us a proper pathway about social understanding and social cognition, which now after so many years with this modern technology and evidence-based, we are doing a simple experiment and confirming what was given so many years ago. Then the third thing is proneness to guilt, shame, and pride in children with autistic spectrum disorder. This is another very interesting study. The children with autism do not have much guilt or shame or pride. They are not guilty of the mistakes they are doing. So you have the sensitivity to shame. Nanam, pirar nanatakkadu, taan nananayin. So whatever you feel ashamed of, others should feel ashamed. So you find that the interaction between you and the others. Aram nanatakkadu udaitadu. So you find, I really love this word, nananayin. You find that all the three nas coming together. If others are feeling ashamed and you are not feeling ashamed to do that same thing, that means that is something wrong. That means you are not into the social line. So the types of emotions are, the basic emotions are anger, sadness, and fear. And the other type of emotions are the self-conscious emotions, such as guilt, shame, and pride. So these self-conscious emotions are deficient in children with autism. And the pride can be differentiated as hubristic pride or an authentic pride. Hubristic pride is that I am great.
1 second, sir.
I am a great person.
1 second, sir. Sir, please unmute and go ahead, sir.
Yes, sir. Yes, sir.
Thank you, sir.
So the hubristic pride is that thinking about oneself as a great person, whereas authentic pride is I have done this great job, so I am great. So what is authentic pride can be welcome. It is a functional thing, whereas hubristic pride is non-functional and should not be encouraged. So basically, these self-conscious emotions are lacking in children with autism. and the management is simple: to teach the children the theory of mind. So this is fundamentally lacking in children with autism, the theory of mind, the inability to understand what is in the other person's mind. And the treatment would be to teach the theory of mind, but it is not an easy job. It is really an uphill task. Now, the other way I thought is to give some ideas or clues to the parents to make them easy to teach the child the theory of mind, help the parents to teach theory of mind to the children. The simple clues which in our day-to-day practice, we can use it to talk to our parents. Pay attention to the facial expression of children, especially the eyes, because there is a poor eye contact. And the face is a good tool. Use this face to show off feelings, exaggerate feelings, and let face do the talking. Instead of using words which the child has difficulty in understanding, use facial expressions to show our emotions. And use non-verbal communication. For example, you can ask the child to take this coat by means of eyes or by pointing, rather than using the words, pick up this coat. You can show it by the eyes or even by pointing. So this gives a stimulus for the child to understand non-verbal communication. And play eye-face games. Sing songs with facial expressions. The social stories can be done with a lot of facial expression. These are all the areas where the children with autism are deficient or lacking, which can be supplemented. And parents can talk about wants, beliefs, and feelings from different point of view. I like this, you like that. How to negotiate in life. Having words to talk about what's on somebody else's mind. And similarly, we can see, for example, in a group study, this child likes toys, this child may like biscuits, this child may like something else. We can teach that each child has different ideas or different likes and dislikes in a group play. And encourage different views or different ideas. For example, this child looks into the cloud and thinks it is a rabbit. The other person can think it is just a cloud. So there's different ways of thinking. And starting simple sentences, what is this noise? I do not know. Just a human interaction can be encouraged. Then looking, seeing can be encouraged. See, for example, the parent is turning the pages and the child is looking into the face or the book. Show me what it is, pointing. All these things can be encouraged because these are the primary areas where children with autism are lacking. And the second thing is playing peekaboo or a pretend games. Say, for example, they can hide and ask the child to search in an artificial way. The mother may know that the child is hiding there, but still searching and creating a socially interactive situation. And third is the pretend play, pretending as though there is a bird in the hand and pretending as though it is trying to fly away from the hand. This sort of a pretend play requires a social or a teamwork and an imagination, which is again lacking in autism, which has to be encouraged in autistic children. These are the simple ideas or clues for the parents to do with the children. The overall idea is say less, stress more, go slow and show to children with autism. And talking about wants, a child's likes, dislikes, wish, dream, prefer, love, hope. You can use these words often when during communication with children with autism. In Tamil கூட சொல்லலாம், இது பிடிக்குது, பிடிக்கல, என்ன கனவு காண்றீங்க, என்ன வேணும், வேண்டாம், இது கிடைச்சா நல்லா இருக்குமே. And the words we can use it frequently in children with autism. And talking about thoughts like thinking, not thinking, மறக்கிறது, ஞாபகம் வச்சிக்கிறது, புரிஞ்சிக்கிறது, என்ன விரும்புறீங்க, என்ன ஃபீல் பண்றீங்க, இதெல்லாம் வந்து imagine, guess, all these can be taught to children. And talking about seeing, tell, look, show. We can point out things because the child is not pointing. We can point and show. So these are all the simple clues into which we can show to the parents of autistic children. And drug therapy has not much of a role. We generally use drug for management of irritability, hyperactivity, negative behavioral symptoms, and stereotypic behavior when it is highly problematic and affecting other children's or functioning in a school, where low dose of risperidone, aripiprazole, or haloperidol, methylphenidone already is very useful for attention hyperactivity disorders. I don't use much of these drugs in my practice. And this drug is of promising in the future, oxytocin, because it improves the connection and social cognition in children. Oxytocin, nasal oxytocin, there's study going on to improve the social cognition in children, but it is not yet fully available here. It is in the experimental state. The next is the early intense behavior application to children with autism. So this is a individualized, and this is what we call it as a occupational therapy. Individualized and comprehensive, addressing all skill domains, upright behavior analysis, and parents to serve as an active co-therapist in involving the parents in this scheme. Intervention is delivered one-to-one fashion in intensive, round the year, round the clock, 20 to 30 hours in a week, and slowly transferring the child from the school setting, community, to the preschool setting and elementary school, and finally into the community setting. So the frank communication or the exchange of ideas with the parents will help, and it will go in the long run, establishing a rapport, and the new concepts and new developments should be always be talked or explained to the parents and reassured the parents. So the thought, I think, is get face to face, improve the eye contact, do something unexpected to bring the attention of the child, and wait. Sometimes whatever we do sometimes goes wrong. We do not have the correct pathway, and don't worry, keep waiting. Things will change. Say, do something about the child's interest, whatever the child's interest, you encourage that and keep waiting, and expect something to happen bit by bit, and then wait. So these are all the basic concepts which I thought I'll share with you. Thanks a lot for your patient hearing. Thank you, sir.
Thank you, sir. I'm back. Extremely sorry, sir.
Thank you, sir.
Suddenly Wi-Fi went down. That's why.
No problem. No problem.
Arkena, please come forward. Sir, you can stop your slides, sir.
Okay, sir.
Then everyone will be visible to you.
If there are any doubts, I can clarify.
Yes, sir. Arkena, please unmute yourself.
Now only Bala, I was able to unmute myself.
Okay, okay.
It was complicated for all. Sir, 1 hour போனது தெரியலைங்க சார். நீங்க ஆரம்பிச்சப்ப ஒய் சார் வந்து வழக்கமான நிதானம் இல்லாம இவ்வளவு ஃபாஸ்டா யூ ரஷிங் இட் அப் அப்படின்னு நினைச்சோம். பட் பாத்தீங்கன்னாக்கா 60 minutes வந்து பத்தவே இல்லை. அவ்வளவு வெரி ஃபாஸ்ட், அண்ட் வி வர் ரியலி ஃபெல்ட் டிஃபிகல்ட் டு ஃபாலோ யூ at many slides. It was very very revealing slides. Many of the points we couldn't read out completely.